Thank you so much for joining us right here on Wake Up Nigeria. It's about time for us to have our Tuesday health discussion. And over the past few weeks, we've been discussing bones. We've been discussing different things that can affect the bones, and hopefully you've been learning a thing or two with us. With us, we have Dr. Babajide Lawson, a lead consultant orthopedics and trauma surgeon with Reddington Hospital. Now, it's all about bone infections, but you said specifically that have to do with the joints. First of all, what's the difference between simple bone infections and those that have to do with the joints?
Good morning.
Good morning.
Thank you for having me. So the bone infection just has to do with the bone itself, whereas the joint infection involves the joints. Sometimes it's a complication of the bone infection. Okay. And the other difference is that the joint infection is an emergency. Oh. So okay. if a patient comes in with a suspected joint infection, okay, needs urgent attention.
Okay, so now I'm just trying to wrap my head around what something like that would look like, what sort of symptoms someone should look out for before they would suspect something this serious.
Okay, so let's dial back as per what can cause it. One, it could result from a general systemic infection, so that now goes to the joint. It could come from direct inoculation, so maybe a person had an accident or cut or something into the joints, right? Sometimes it's a complication of surgery, and like I mentioned earlier, it can be a complication of a bone infection. So generally, the person tends to be ill. They may be feverish, but characteristically, it would reflect the particular joint. So take, for example, the commonest joint is the knee. So usually there'll be swelling. That individual would struggle to walk because the joint is swollen, painful, and bending the knee would cause a lot of problems. So that would make walking difficult. If it's in the shoulder, then movement of the shoulder can be a bit difficult. Now, it's not every shoulder difficulty that is septic arthritis, and there are a particular set of people that may be predisposed to that. Immunocompromised individuals like diabetics may have that, and then sickle cell disease patients.
So I'm going to take you back now. You said septic arthritis.
Yes, septic
arthritis. So a lot of people, a large percentage of people are living with arthritis.
Yes.
What's the difference between septic arthritis and the most common form of arthritis? Okay,
septic arthritis is the presence of an infection. Okay. Versus arthritis, which is just age and wear and tear we use. Okay. So there needs to be something, an infective process, an organism, bacteria that would come and trigger. And the problem with it is that once the bacteria gets in, it destroys the cartilage. And the consequence of that is rather disastrous, because the destruction of the cartilage can start as early as 8 hours after the bacteria takes root. Wow. So it destroys the joints, can make the joints permanently stiff, because it now destroys the cartilage, the bones join up together, the joints can't be bent. So for example, if it's the knee, yes, the person probably would struggle to bend. If it's in this position, it will just be like that. Can go up, can come down.
It stiffens.
Exactly.
Completely. Okay, so is there any kind of gradual progression from simple arthritis, which is wear and tear, to an infection? Or does there have to be an external factor?
There has to be an external factor. Okay. There has to be an external factor. And thankfully for that, it's not very common, and there has to be an external factor for that to lead to septic arthritis. So
the person living with arthritis now doesn't have that much to worry about except external factors such as some kind of trauma before they should be worried about septic arthritis?
Yes, pretty much so. Okay. There needs to be something that will introduce the organism into the joints. Okay,
so now there are people who have extreme activities, extreme stress, extreme sports that are going through, like I'm talking about sportsmen now, like footballers, basketballers, and things like that. Are they prone to these kinds of infections?
Not actually, because there also needs to be some degree of immune compromise. Okay. meaning that for some reason your immunity is low, because ordinarily the body can fight off a lot of things. Okay. So, but there needs to, so it's either the load, the organisms are so much, maybe like in an accident, the joint is cut, or there's a big wound, and then debris or things get into it, or the person is really ill and then gets that as a complication.
All right, even though I've been trying to avoid it, what are the worst case scenarios when it comes to bone infections concerning the joints? You did say it's an emergency.
Yes.
You did say if you see any signs of it, you should rush to the hospital.
Yes.
What is the worst case scenario?
Worst case scenario would be it's not attended to on time, and then it destroys the joint.
Okay.
And the destruction of the joint can lead to so many issues: shortening of the limb, difficulty in walking, stiffness. The plethora of things you actually do not want to happen. And it's worse once it's in children, because they still have great growth potential. Okay. So it affects them on the long run. Okay.
So it doesn't lead to things like gangrene and
no.
What's the word? I was trying to avoid it so much it's gone now. I'm talking about when limbs have to be lost. Oh no, there won't be. Okay, there won't be an amputation for that. So in the hip, it could lead to a dislocation, which could potentially destroy that hip, and the person may need a hip replacement in future. Okay. Same thing with the knee and things like that. All right, Dr. Lawson, you know, you always help us make things so clear, especially with regards to our bones. Let's take care of ourselves, people. Let's look out for these things. And if you're living with any conditions, go get checked out with your doctors. We'll continue this conversation on social media. Use our hashtag WakeUpNigeria on TVC when you're posting. At this point, we have to hand it over to the kitchen. Mary, how's it going?